Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. Today I'm answering the question, how soon after I have my baby should I do my first postpartum visit? That's a great question. I'm here to answer it. What I tell my moms that are getting ready to give birth is basically, how are you feeling? Let's check in with you after birth to make that decision. For some people, they're fine to wait for 6 weeks after they have their baby. They go for that first postpartum checkup with their provider, and then they decide to come in or do a virtual session, and they do the postpartum healing after that. That's okay. However, for some women, they're suffering with a lot of issues prior to that 6 weeks, and they feel like they need to wait. So I want to address this and tell you, really, it depends. I know that's not probably the answer you're looking for, but I want to give you a little more guidance with that. Basically, what I say is check back in with yourself. How are you feeling? Of course, if you have a vaginal birth or if you've had a C-section, we expect there to be discomfort into those areas, right? Into the lower abdomen, into the pelvic area. However, if you're having pain into your back, your SI joint, down here low, into your hips, it's really interfering with your ability to get quality sleep. If it's interfering with your ability to do your day-to-day things like take care of your baby or take care of the things that you need to around the house, that's an issue and that can be resolved. We can do a lot of great things to help with your pain. So if you're experiencing any pain like that, you don't have to wait for 6 weeks. You don't have to suffer. There is help available. The other thing, if you're feeling on edge or it's really impacting your sleep, of course, we expect newborns to be waking you up in the middle of the night for feedings and things like that. But I'm talking about if you just feel like you're anxious, you can't rest, you can't, like, you just have that underlying kind of nagging feeling that something's off, then that's a good reason, believe it or not, to come in for a postpartum visit, because things can be done to help you regulate your nervous system and help you feel better so that you're not on edge. And we can do that again, virtually or in person. That may be a sign that you had some birth trauma or that your body is just trying to regulate again after this big event in your life, okay? But things can be done. Speaking of birth trauma, some of the signs that you want to look for and take note is just thinking back over your birth. Does it bring up any overwhelming feelings, okay? Was there any part of your birth that felt like it sped up and kind of got out of control where you felt like just went a little fast? Were there any interruptions in your birth flow, meaning maybe there was a lot of medical intervention, or maybe you were separated from baby after birth? That can be a sign of birth trauma. Periods of your birth not being remembered, okay? So if you kind of think back through the birth of your child, are there periods of time, like chunks of time, that you can't recall? That's a sign of birth trauma, okay? So again, there are things that can be done to help you feel better, regulate your nervous system so you can get that quality rest that your body needs. If you're having breastfeeding issues, so I see a lot of moms that have concerns with breastfeeding. There might be pain with latch on. There might be concerns about milk supply. So if anything with breastfeeding, and particularly if you're working with a lactation consultant, that's great. That's a very great first step. However, there's things that, believe it or not, a physical therapist can help you with this process. Sometimes there's underlying tightness into the breast tissue or into the chest area that can be addressed that may be impacting your ability to breastfeed. So get in as soon as possible for that, because we want you to be successful with feeding your baby. If you have any pelvic floor concerns, so if you have noticed any changes in bowel or bladder function, particularly if you're leaking, feeling a lot of urgency, particularly if you can't control your bladder or your bowels, or you're having issues with even being able to initiate urination or bowel movements. And also if you're experiencing some pelvic pressure. So, you have to use your best judgment with that. If it seems like it's not getting better, then please get in. There's definitely things that we can address, that we don't necessarily need to go right into that pelvic floor area. I do want to say we don't do a pelvic assessment for the first 6 weeks postpartum, regardless if you've had a C-section or a vaginal birth. We simply let those tissues heal. Hopefully that gave you the guidance that you need to know when you should do that first postpartum visit. If you have further questions at this point, I'd be happy to guide you. Simply reach out to us, go to our website, or use the link below. You can do a consultation call with myself, either on the phone or even via video. So use one of the links below. Thank you.